Hi everyone, this is Divya from Quick Mommy Hacks, and today we are going to talk about fibroids and pregnancy. So, many women in their childbearing years have non cancerous growth in their uterus, and they are called fibroids. And fibroids can often present challenges in pregnancy and delivery. And we have Betul Pamuk today here to discuss her journey and her story about her pregnancy and her delivery. She had fibroids when she was pregnant, and she is going to share her valuable thoughts with us today. So, hi Betul, how are you?
I'm good, Divya. How are you?
I'm good. So, thank you so much for joining us today and to share your journey with us about your pregnancy and childbirth. And I know that you had fibroids and you had challenges as well. So, just tell everybody like just a little bit about yourself.
Thanks for listening to my story. I'm a mom of a 15-month-old boy, and I'm also a physicist and a researcher.
When and how did you find out about your fibroids?
So I went to a doctor to confirm my pregnancy, and then the midwife saw me, and when she actually physically um, um, when she physically checked from the outside, she wasn't sure if I was really only 1 month pregnant. So they were actually big enough to be visible from outside. I just didn't, I thought I gained a little weight. I didn't think they were fibroids. But they did a quick ultrasound check and my baby was fine. And they did a follow up check after to confirm the size of the fibroids. And that's how I found out.
So, what was the size of your fibroids?
I had 3 fibroids. One was about 7 centimeters, the other one was about 5 centimeters, and the other one was about 3 centimeters.
So, when you found out about your fibroids and upon your diagnosis, what kind of advice or recommendations you were given regarding, how your pregnancy is going to look like, and about, the complications during the pregnancy, and if you'll have a healthy pregnancy or not? Yeah.
So, what I immediately came to learn are that fibroids are tumors, but they don't necessarily mean cancer. Tumor is just an excessive amount of tissue. And the way doctor explained it to me was that the tumors are feeding through blood, so they can compete with the baby for blood, and that can create issues. So the babies can be small, or there can be throughout the pregnancy fibroid pain. But they usually don't necessarily mean a harmful pregnancy. And they were very comforting actually when they mentioned all these things to me, that most likely I will have a healthy baby. And depending on the position of the fibroids, I might actually deliver vaginally. So they, throughout my pregnancy, they would check how the fibroids are growing and if they are moving or not.
So, where were your fibroids located?
So I had one that was really on the upper uterus, but there were 2 that were closer to downside of my uterus. So they really wanted to check if those will block delivery or not, or if they will move out of the way.
Yeah. Okay. So, based on your diagnosis, how was your first, second, and third trimester like?
I didn't have any issues in my first trimester, just usual nausea, which I usually try to keep myself full and not starve myself, and that helped. In my second trimester, so the fibroids, one of my fibroids was actually not getting enough blood, and that was causing it to sort of disintegrate. That's how I understand in layman's terms. And the next morning, I went to my doctor's office, and he gave me specific medication that is suitable for that term of my pregnancy at the beginning of my second trimester. And I took that medication as needed, and it lasted for about 10 days. The first few days being really, really painful. I actually think it's the worst pain I ever experienced in my life. and I experienced a little bit of labor pain, which we'll come to, I think. And actually, my doctor warned me that it can happen again because as the baby grows, your body's producing growth hormones, and that lets the fibroids to grow as well. So on the third trimester, my fibroids actually grew in size, and they were expecting more fibroid pains. I was lucky that it didn't happen, but it can happen, especially towards the end of the pregnancy.
So looking back, do you think you ever had symptoms that could have indicated that you had fibroids, like before your pregnancy?
No, that was one of the issues. The symptoms that they said were really heavy periods, really painful periods, and maybe constipation. I had slight constipation every now and then, but who doesn't get it due to foods you eat? So no, none of the symptoms, I didn't experience them. And really, a lot of women have fibroids that are small. And the only way to find out about them, especially the small ones, is doing an ultrasound.
So fibroids are often linked to complicated delivery. So what kind of a delivery did you have? Did you have any complications during your delivery?
So I mentioned earlier, two of my fibroids were at the lower uterus, and one of them actually was so low that it blocked a vaginal delivery. So I was scheduled for a C-section. My doctor referred me to another doctor actually in a bigger city because where we live, the hospital doesn't have a trauma center. And fibroids can bleed a lot because there are a lot of veins around it. So that for that reason, I was scheduled in another hospital that's an hour away, a bigger one that has a trauma center. For the C-section, a scheduled C-section, you give blood. So I was scheduled for the 5th. On the 3rd, I went to give blood, and everything was fine. And then we came home, and I felt a little tired. I went to lie down, and when I woke up, I started feeling some pain that resembled period pain, and we started timing. And we felt that I'm in labor. So we called my local doctor. Well, it was middle of the night, so we called we talked to the doctor on call, and we also called the doctor in Syracuse, the big city, and they decided that I should go to the bigger city, to the hospital that has a trauma center. And we had enough time, so we just drove there, and they checked and they confirmed that I was in labor, and I ended up having an emergency C-section.
So were you given any advice how to manage your fibroids post your delivery, like perhaps a surgery or something that they recommended?
Right. So they don't remove the fibroids during the C-section. All my fibroids doubled in size, and they removed the smallest of it, which was closest to the baby, during C-section. But the others they don't touch. They don't touch them unless they have to. And they wait for the uterus to shrink, and they hope that they might shrink back in size. And at the same, also the uterus wall gets thicker, which makes it easier for them to distinguish between the fibroid and healthy tissue, uterus tissue. They didn't grow small enough that they can remove them with laparoscopy. So they are suggesting that I have an open surgery. But they want me to have an open surgery and get them removed if I want another child. But if it doesn't affect my daily life, there are no pain, no heavy periods, and I can continue with my life. Actually, they don't do any harm, so they can stay there. After the surgery, if I want another child, there are risks. They will probably schedule an early C-section because the uterus can rupture. There's no way that I can deliver vaginally.
Okay.
Yeah.
So, based on your journey and your experiences, do you have any advice for women who are pregnant with fibroids? What kind of steps they should take to manage it, or what options they should be having like after the delivery, or how should they manage the delivery?
Mm-hmm. So in general, I would advise all women to get checked regularly,
Mhm.
even if they don't consider getting pregnant. I sometimes look back and think if I hadn't had a one year relapse between my regular checkups, maybe these would have been found
Yeah.
out before, and I would have maybe an easier. I would probably have another C-section, but it would be easier that I wouldn't go through that fibroid pain during pregnancy, which was scary. So that's one advice. The other advice is know that you can call your doctor anytime, even if it's a weekend or in the middle of the night, and know which numbers to call. And the third is I am the type of person who doesn't like taking pain medication. But when it's about fibroids and also with C-section, you can take your pain medication so that you can feel yourself, and after C-section, take your pain medication so that you can feel better to take care of your baby. So those are the main things.
And anything with respect to the diet or the lifestyle during the pregnancy time?
Okay, so for me, I had also in my last trimester, I had gestational diabetes, and that is a genetic. In my case, it was genetic because both my grandparents have diabetes, and that I was able to manage with healthy diet. I cut back on a lot of sweet things and got a balanced diet, and I was able to control it. So that's the main issue with that.
Okay. So, I mean, your journey has really been very challenging, and both the pregnancy and delivery. And thank you so much for sharing all your thoughts and all your advices with us. I'm sure it will be definitely be helpful to other women who are listening to it. Thank you so much.
Thanks for having me.
If you like our videos, do subscribe to our YouTube channel, Quick Mommy Hacks, and follow us on Instagram for some personal tips on pregnancy, childbirth, and motherhood. And do leave your feedback and comments. We would love to hear from you.